Hello, everybody. I'm really delighted to be here today at the launch of the Quality Framework, which is the next step in quality improvement in mental health services in Ireland. I think it's coming at a very exciting time in Irish and indeed international mental health care, because there's been a shift in emphasis from a paternalistic model of care to a recovery and person-based focus, to a promotion of human rights, inclusiveness, and having service users not only involved in their own care, but also in how services are planned and delivered. And indeed, service user consultation was at the heart of producing the framework. Gary and his team also looked at quality improvement internationally to ensure that the quality framework included all best practice elements. As you are aware, my team of inspectors and I inspect compliance with regulations, rules and codes of practice in approved inpatient units. And over the years, we have noticed how engaged the mental health services are with not only compliance, but with improving the quality of care that they provide. They embraced, for example, the judgment support framework, which allowed them to look at how they were delivering their mental health services above and beyond just compliance with regulations. But we have noticed over the years that poorly performing services often rate highly on compliance and on their own audits. The quality framework now allows the services and indeed encourages them to tailor their auditing to whatever service they themselves are delivering. The quality framework will provide a mechanism for services to continuously improve and be able to demonstrate that improvement. Good corporate and clinical governance are essential. Improving quality is not something that is just done at ward or unit level. It requires good leadership and accountability to work, and indeed, this is the first theme, as Gary has said, in the quality framework. As we move beyond just compliance with a regulatory framework to quality care, provided and monitored by processes within the mental health services themselves, using self-assessment and quality improvement cycles. The themes within the framework will aid services on the journey to better quality mental health service provision. As inspectors, we will be monitoring that journey, reviewing how services are incorporating the themes at all levels of delivery, how they are assessing and monitoring their progress, and how they are introducing improvements. Our inspection findings will then be incorporated in our reports. And it is exciting for another reason. We have the new mental health legislation imminently. I put in brackets after this, I hope, but the Minister has assured us, I think, that it should be coming soon. As the Mental Health Commission remit expands and we begin to regulate community services, the framework will assist the community services to standardise care, to monitor their progress, and be ready to be compliant with whatever regulations are coming for them. I think I'd just like to say that I've been around a long time, and I've been a long time inspecting, and the things we saw initially would make your hair stand on end. It certainly made my hair stand on end. My hair doesn't stand on end anymore. Occasionally it gives a little quiver, but things have improved, and people are interested in quality, and people want to move on from just compliance, just tick boxes. They want to provide a good quality service, and the quality framework, I know, will do that and will help services. And I'm very encouraged to see here people who work at all levels of service delivery, and that in itself is very encouraging. So I'd said to Gary and John that I would be brief. I practiced my speech in front of the dogs this morning, and they approved of the brevity because they were waiting for breakfast. So I'm going to finish on that note, so thank you very much.